Good morning, everyone, and welcome to Healthcare a Better Way. We're excited to have a number of you on today. If you've joined us before, you know this is our second installment of webinars related to this particular topic. And what we're thrilled to do today is to share with you really an in-depth overview of the individual healthcare plans that are created for realtors and for other self-employed professionals. Joining me today is one of the founders and creators of the integrated solution that we're going to share with you that is America's Benefits Consortium's health plans. So joining me is, and our presenter today is Troy Neiman, or Neiman. Troy, I always say it wrong. Is it Neiman or Neiman?
It's actually Nyman.
Nyman. All right. So Troy Nyman. I know how to spell it, but I always butcher it when I say it. So Troy Nyman is joining us today. Troy, take it away.
Yeah, good morning, everybody, and welcome to the webinar. So it's a great time in our country for us to be looking at healthcare a better way. And so one of the things we like to start off with is when we think about healthcare, I always pose the question, is it really insurance that we're looking for when it comes to healthcare, or is it really quality healthcare at the right time, the right way for the best cash price? And I think what happens is most people agree that in order to really change healthcare and get to a healthier culture, it's about getting the right care at the right time for the best price. And so today is all about learning healthcare a different way. So we've built these programs to really address high functioning, high quality healthcare. So that said, a little bit about the program. Basically, this is not insurance. So this is health care. So it's really more about a one-to-one relationship with the doctor. It's for individuals and families. It's for consumer direct, self-employed, and professionals. But the big differentiator is there's no deductible, there's no copays, there's no co-insurance, and you'll find that the maximum out of pocket is very low. So when comparing traditional high-cost insurance with high-functioning quality healthcare, there's a huge difference. And we really need everybody's help in America to make this better, because as a country, we innovate incredible and we can really bring together a better healthcare option. The beauty of these plans is these are board certified physicians that have been in practice for years. They go through a very stringent credentialing process. All members are eligible. It's very fast and easy to do on a technology platform. So think of it like Uber, where we bring the consumer to the provider on one beautiful enrollment single sign-on engine with a digital health portal. There's really no other plan like it anywhere. It's really healthcare reimagined. So it does take primary care and combines it with cost sharing. And so we'll talk a little bit about that. But first, let's cover the three plans.
Hey, Troy. I hate to interrupt you mid-sentence there, but I just wanted to let you know I'm hearing a good amount of kind of air. So I don't know if your microphone's kind of what the situation there is there, but I was wondering if maybe you could adjust that just a touch, because we're getting kind of this blowing sound over the mic. But if you could do that and then just carry on. Thank you.
That should be gone. I think I removed that.
Yeah.
That was a AC fan system, so I turned it off. Thanks, Mark. So the three plans I want to introduce, just for basic understanding and concept, is with America's Benefits Consortium, we offer a basic plan, which is really an entry-level plan for those that are conscious to budget and need the bare minimums, especially during a pandemic. The second plan is called the enhanced plan, which takes the plan a little bit to another level. It adds some more features and allows a little bit different budget planning. And then there's the premier plan, which we'll talk about a little bit, which is really one-to-one and has all the bells and whistles, kind of like the leader. But first, let's take a look overall. How does this work? So people, a lot of times folks ask, okay, if this isn't insurance, why is this better, or how does it work? What we want to focus on is getting people back to primary care unlimited. So if you think about your cell phone, when today we purchase a phone and we get a data plan, usually it's unlimited data for a monthly subscription. So what's happening is a lot of these primary care board certified physicians, MDs, are leaving the networks or no longer accepting insurance. So they're really doing concierge or monthly subscription. So what we've put at the heart of these plans is a primary care doctor that is yours, dedicated, one-to-one, that knows you personally. They know your family history, vaccines, they know your lifestyle behavior, and they work with you in proactive health management. And the beauty is you can see them unlimited, where you don't have to do appointments, you don't have to do a copay. It's much different. It's really right in, it's unlimited access all the time. So the beauty of the doctor, let's go back for a second, Mark. The beauty of the doctor really is to manage all your annual exams and screenings, to really be your advocate and your navigator, to really be your quarterback of healthcare. And a lot of these physicians have lab or x-ray in-house. Some don't, and if they don't, that's okay because there is an x-ray and lab benefit through Quest Diagnostics that we'll talk about. When it comes to specialty care, they have incredible referrals because they know who's the best in their community at specialty surgeries or things of that nature. They're also trained in mental health, but most of all, I wanted to emphasize that they're really your quarterback of care one-to-one, much different than like teledoc, which is urgent care that doesn't usually know you. This is more primary care. So beyond primary care and having unlimited access, here comes the second part, which is the what if. And a lot of people say, okay, that's great that I'd have a doctor one-to-one. I'd be able to do all my day-to-day with that doctor, text, email, virtual, or on site. But what about if I have an emergency? What if I have cancer? What if I have preemie baby or I'm traveling in a foreign nation? So the beauty of the program we've built is there's no network. So you're allowed to go to any provider, any hospital or facility, any surgeon worldwide. So you don't have to, there's no network. You don't have to play with a network. That being said, this really covers your emergencies, your hospitalization, your surgeries, urgent care, specialists, and again, no network required. It's worldwide. The beauty of this is where once you go beyond primary care and you need surgery or hospitalization, this is when we use what's called medical cost sharing. And in medical cost sharing, a lot of other programs out there require the member to try to navigate this on their own, negotiate their own payment, and pay up front, and then try and get reimbursement. In our program, the members get an ID card, and they're only responsible for what's called their IUA, which is an initial unshareable amount. Kind of like a deductible, but it's the first dollar amount a member would have to pay if going beyond primary care to use hospital, emergency, or surgery. So in this scenario, a member would really just pay their IUA up to 3 times in a year per household, not per member, but per household. So when you really boil the plans down, if we take the 3 plans and we kind of break them apart, your basic plan is really kind of your loss leader. It covers your doctor unlimited. It has all your annual exams and your preventative maintenance. It's got no copay or deductible, so you can see your doctor unlimited, in person, virtual, text, email. They get discounts on specialists and labs. And then there's also a pharmacy benefit. So if they need pharmacy, there's a true PBM is what we call it, where you pay a copay for generic and a copay for formulary. There is an annual deductible. And then there's the mental health benefit. But there's no cost sharing in the basic plan. So it's kind of your loss leader designed to get people back to a doctor, be managed, especially during a pandemic when people really need one-to-one care. The second benefit, really the enhanced plan, what we've done is we've taken all the components of basic and we've added cost sharing to give you the major medical worldwide with no network. And in the premier plan, the real difference now is a brick and mortar doctor. So the basic and the enhanced are virtual only. So these are real doctors licensed in your state, board certified MDs that have been practicing for years. Sometimes they're retired surgeons or they're doctors that want to do family practice. They are your dedicated doctor. They're your source of truth. They're who you go to for everything. And then they refer to specialists if needed. The premier plan is really that primary care doctor direct. So this is a doctor you can go to their clinic, see them face to face, unlimited care, and then they also have virtual. So the premier is kind of the ultimate total experience. The enhanced is kind of middle of the road virtual, especially during a pandemic where you have access to quality care that knows you 24/7. And then there's the basic, which is really the entry level. Mark, let's move on from there. Um, so let's talk a little bit about virtual primary care. So what is virtual primary care? What's really happening is a lot of folks are used to teledoc. And what teledoc does is it allows you quick access to a qualified medical provider. Usually they don't know you, they don't know your records, they aren't doing your family history, vaccines, and personal management, but they're available for immediate triage or consultation. Usually they can order prescriptions, things of that nature. In our program, we use virtual primary care. So once again, instead of teledoc, this is your doctor unlimited that knows you. So it is your primary care doctor, your quarterback of care, your advocate, your navigator, and they work for you. They don't work for the insurance company, they work for you. So think of this as subscription medical direct. It's unlimited, 24/7, 365. You don't have deductibles or copays. You don't have to make appointments. They're literally in the palm of your hand through technology. It's universal acceptance. There is no issue of pre-existing condition when it comes to the virtual care component. It's a member first approach. Your data is all protected under HIPAA and PHI, personal health information. There's full live video chat, all your digital history, and you can enroll at any time. So these programs are month to month. So a lot of folks in traditional insurance are used to a 1-year contract. In these programs, you can change month to month. So if you wanted a different plan the next month, you could go in and change. You could change your payment method. It's really self-registration, your own digital health portal, and allows you all the freedom. The difference between virtual primary care and direct primary care is really direct just means on site. So it's a brick and mortar facility or clinic with a doctor you can see face to face that can actually touch you hands on. But whether it's virtual or whether it's the direct, they both offer the same amount of coverage, which is free annual exams. You have unlimited access to a doctor who knows you, no copays and deductibles. They are able to refer you locally to who's the best in your community for specialty. Sometimes they can help you in-house with prescription or lab. If not, we have lab and x-ray built in the plan and pharmacy built in the plan, as well as mental health with the major medical. So let's go ahead and move on to the next slide. So a little bit about providers. So a lot of folks start asking the question of, wow, so where are your doctors? Who are these doctors? And we have a directory. And so when you load into these plans, whether you choose a virtual plan, which we have doctors everywhere in every state. So all 50 states are covered with board certified physicians that get assigned to you as a primary care doctor. If you're looking for the clinic doctors or the brick and mortar, which is the premier program, those are found in our directory, which upon enrollment, you'd be able to select within a 100-mile radius of where you're at. You'd be able to see which clinics we've contracted, which primary care doctors are available. The other one that comes up is folks ask, what if I have my own doctor and I'd like for my doctor to take care of me under subscription of these plans versus my insurance plan? What we can do in that case is you can let us know, talk to your doctor, and if they contact us or we can reach to them, we could offer them our contract to be unlimited primary care under our scope of services. So we do allow doctors you might know that's consumer driven where they could partner with us and then be a part of the program. And so that's kind of how the directory works as far as virtual and as far as primary care direct. The pharmacy benefit, this is just a little overview. We do use a global pharma, which is called Pure Health. It is a true formulary. So all throughout the nation, I think there's 100,000 facilities like Costco, Walgreens, you name it. You just go in and present your card. It would be a $10 for generic, $30 for formulary. There's a $250 annual deductible, and then we've capped the benefit at $250 a month to keep the costs under control. And once again, if someone comes into this plan and they have major disease such as cancer or multiple sclerosis or something really serious, this might not be the plan for them because this isn't insurance. This is high quality care with all the components built into it. The lab program we use is Quest Diagnostics, and the key to the lab is really we're leveraging a national contract where when members go in and use lab or x-ray, they get up to 75% off the retail price. So it's still cash out of pocket, but you're getting up to 75% off compared to a normal health plan where you have to pay co-insurance or deductible, or if you're just paying out of pocket. The mental health component, we've partnered with the National Counseling and Mental Health Organization. It's very good. So this isn't an AI or chat bot. This is real trained counselors. That's more of an assistance program. So it's free consultation. Members get up to 8 visits where you get assessed and they will coordinate your care with primary care, your doctor, and they'll work with counselors to deal with depression, post-traumatic stress disorder, stress, anxiety, eating disorders, marital counseling, financial counseling, anxiety, you name it. So it's really a full-blown mental health service that coordinates with primary care. So a very powerful benefit we know that during times of pandemic is going to be really important. And then the last piece that kind of brings it all together, or the wrap around the primary care doctor, is the cost sharing. And in cost sharing, it's really the same or similar to insurance, where it's a pool of money where we're paying into it every month with a premium, and then claims are being paid out once a member pays their initial unshareable amount, or their IUA. Everyone's accepted. It shares in the costs. It's a very healthy living promoted program. It's very attentive to needs. There's no annual caps. So some people say, oh, well, this is great, but if I go in, I'm capped on the amount of benefit that's paid for my, my need. And the answer is no. The program we use, there's no cap. So if you had something major happen and the bill was atrocious, as long as you pay your IUA, which we'll talk about those in a minute, then your bill would be paid 100%, no cap. Um, it's basically worldwide, and there's no network. So it offers a tremendous amount of value compared to normal insurance. But digging or drilling down a little bit deeper into this IUA, or initial unshareable amount, members are allowed to pick of 3 plan levels. So there's a 1,000 plan, a 2,500, and a 5,000. The key to these plans is that's the amount a member would have to pay first, up to 3 times per family in a year. So think about it. If you chose the 1,000 plan and you had a major event, the most you'd have to pay out of pocket for family would be $3,000. Now take a look at your normal insurance plans and ask yourself how much you'd have to pay with copay, deductible, coinsurance, and max out of pocket on all family members. It really doesn't compare. Mark, let's go back for just a second. So the other one is, I was just looking at the qualified medical expenses. So once the IUA is met upon an event, and remember, this is outside primary care. So primary care, pharmacy, lab, and mental health, they don't have any pre-existing condition limitation. They're unlimited. But when it comes to major medical, one of the benefits that keeps our rates low and really protects the pool and keeps people working with primary care is what's called a pre-existing condition limitation. So Mark, let's go ahead and switch to that.
Okay, Troy, just before we do that real fast, I've had people ask me about this particular slide before when they see the presentation. So I just wanted to clarify, because when you read that piece right here, I'll put my mouse on it, all qualified medical expenses submitted within 6 months. That doesn't mean you have to wait 6 months from the time you sign up to have care submitted to the medical cost sharing, does it? Can you explain that, please?
No, so members in our program have a medical card through our cost share partner, which is Zion Health. And what happens is that card has a phone number on it with your ID number. So any provider in emergency, surgery, hospital, you name it, they're going to contact them for billing. And what they're going to say is, as long as the member pays their IUA, their first dollar responsibility, which is either the 1,000, 2,500, or 5, up to 3 times in a year, then they pay 100% cash direct to the provider on the spot. So they usually pay it within 5 business days, which doctors and facilities love because they're getting paid right now. The other beauty is they medically manage it. So between a nurse team and a medical director doctor, they make sure you're getting the right care at the best price. So they'll ask that facility or that provider on your behalf what their best cash price is, and they pay it immediate. If the facility doesn't accept cash for best price payment for the procedure, once you've paid your IUA, then we fall back on a network, a PPO network called PHCS Multiplan. So our cost share company will pay on billing with PHCS Multiplan if the provider doesn't take cash direct. So it really takes care of the member. The member just needs to go and have a great experience, be taken care of, pay their IUA, and the rest is covered 100%, no cap. Does that make
So just to
sense?
be, yeah, and so just to be clear, this piece right here where it says all qualified medical expenses submitted within 6 months, that means submitted by the provider. So you have some event that requires you to need care, and the medical cost sharing component would be paying that. It's saying that the provider needs to submit that, or you need to have that submitted from the provider within 6 months. It doesn't mean you wait 6 months to be able to
Correct.
submit that or have care. And that was just a little confusion we had at one point. So I wanted to make sure you covered that for us. I think this next slide kind of goes more into the pre-existing you were referencing.
Yeah, so this is one of the, membership has its privileges. And one of the reasons this is a high functioning, high quality healthcare plan is because it really gets people back to that one-to-one relationship with primary care. So that's unlimited. So people can use that all they want, work with their doctor all they want, that can manage, 35,000 disease conditions and do a lot at the primary care level. But if someone has a diagnosis before they enroll in the plan, and it's a 24-month look back, so it's in the past 24 months, if you've had a diagnosis, that's considered pre-existing condition. Now, with pre-existing condition, they don't discriminate against anybody. What they're saying is to protect the pool from adverse selection and to really get people back to primary care. If you have a major medical event related to that pre-existing condition, in the first year of membership, you'd have no coverage related to that condition if you were hospitalized with surgery or emergency. Has nothing to do with primary care, pharmacy, lab, or mental health. It's just major medical. In the second year, you'd have up to 25,000 of benefit towards that condition. In the third year, you'd have up to 50,000, and in the fourth year, you'd have up to 125,000, and then in the fifth year, you'd have 100%. So it's really a phased in benefit limitation regarding pre-existing condition. Now, there's exceptions. This is beautiful. So if you have, let's say, high blood pressure or high cholesterol or diabetes type 1 or type 2, and you have not been hospitalized in the past 12 months, but you're controlled by diet and medication, then that's waived. So it's an exception to the pre-ex. So as long as you haven't been hospitalized in the 12 months with those conditions, and you're compliant with medication or diet, then it would be waived. So you wouldn't have pre-ex related to that because you're compliant, you're under management, and you're taking care of yourself. So this is how the risk management protects the pool to make sure we're really working with primary care, we're managing our health. And then for that, we get a huge break in the premium, which we'll show you in a minute. Now, this slide really breaks down or helps us understand the difference between paying cash for procedures across America versus buying insurance on a PPO discount or an HMO discount. So this is just a quick snapshot to help people understand this is something in healthcare literacy that a lot of Americans I don't think realize. And that is, if you look at these procedures on the left that are coded procedures that often insurance will bill through a hospital or through a specialist, if you were to pay the cash price in the first column, you can see what the doctor accepts for cash. In the second column, you'll see what they bill to insurance. So that's the code that they would bill insurance for the procedure. And then the third column would be the discount on a PPO contract after the retail is billed, showing you the difference in the fourth column. And then it shows you in the fifth column the difference between cash and PPO markup. So this is something we're trying to help, and this is right off an audit from Blue Cross, United, Cigna, and Aetna. So I share this to help people realize there's a significant difference between providers and true cash price at discount for the same quality of work versus a PPO contract or HMO. Most people don't understand this because they're used to just paying a copay, a deductible, or coinsurance, but they're desensitized from the real cost of health care. So that's why in our program, we have our cost share will pay direct. We pay on your behalf after you pay your IUA. But the whole program is much more efficient. It's coordinated care, and you get unlimited coverage worldwide. Um, so here's a quick snapshot on the rates. So the basic plan, member, which is virtual primary care, pharmacy, lab x-ray, and mental health, but no cost sharing. This is really your bare bones model, is $90 per member per month, $144 for member and spouse, $158 for a family with children, or I mean a member with children, and then $212 a month for member plus family. And these are fixed rates nationwide. Um, the enhanced plan, which is same plan, it's virtual primary care with pharmacy, lab and x-ray, and now we've added the major medical cost protection, which is really the medical cost sharing. If you're under the age of 50, for a member only, it's $355 a month. If you're over the age of 50, the rates change because obviously there's more medical management. We use healthcare more when we get older. But your IUA would be the 1,000. So remember, you'd only have to pay the IUA 3 times per year for your entire family. So let's say you had an event and you go into emergency, you'd pay your first $1,000. Let's say it's a broken leg. So you'd pay your $1,000, then the rest is paid through your ID card, through your cost sharing. They'd pay 100% on your behalf. Now, let's say 6 months down the road, you have a blood clot related to that broken leg. You wouldn't have an IUA again because it's related to the same event. So once you've had an event, you don't pay any more IUAs related to that event. So second, let's say you have an event, your spouse has an event, and your children have an event, you'd hit your three. So there'd be three IUAs in a given year. Then after that, 100% is covered. So there's no cap. So I show people that really your maximum out of pocket is 3,000 per year for a family, which is incredible compared to traditional insurance. So this is the rate grid that breaks down the premium per month, which includes everything. So in this rate per month, you get the doctor unlimited, pharmacy, lab x-ray, mental health, and full medical cost sharing worldwide. So if you're a smoker or there's a smoker in the family, there is a one-time surcharge of $60. It's not $60 per smoker. It's a one-time surcharge for the membership of $60 per month. And then at the very bottom, you may be in a state that requires ACA or what's called the mandate, preventative services. So we have a way, depending on when you enroll, if you're in one of these states, California, New Jersey, Vermont, or Rhode Island, we add what's called a minimum essential coverage plan, which gives you the 100% paid preventative services under the ACA. Plus, it allows you on your tax returns to show that you have a qualified plan and may not be susceptible to the ACA mandate or penalty. So I just share that under disclaimer so people understand that.
Yeah, and for those of you here in Arizona, that doesn't apply, so we don't bake that price into it because it's not necessary. But in those states, they have a state requirement that if you do not have individual health care that is considered ACA compliant, then they tax you, which is why Troy built that provision in if you're in one of those states.
Yeah, thanks, Mark. And then the Premier plan, really remember, this is the plan with all the components, including a doctor that's brick and mortar. So this is the one where it's the doctor that has a clinic. They see you face to face. You have virtual with that same doctor, text, email, video. You have, this is the unlimited Cadillac. So this is really where you have that intimate one-to-one relationship, proactive managed care. You have worldwide coverage with cost sharing. The Pre-X still applies for anything cost sharing related, but nothing compared to the, you don't have any Pre-X when it comes to primary care, pharmacy, lab, or mental health. So really this is a comprehensive, high functioning, high quality, one-to-one relationship healthcare plan, but it's not insurance. And that's why we challenge people to say, is it really insurance we want? Or is it really high quality care at the right time, the right way, for the best price because it pays cash direct, which providers and hospitals love, and we're getting the best discounts. So it's protecting the pool, which keeps the rates down. And so this is why I share with a lot of folks worldwide that it's really hard to find an unlimited health plan out there where you have unlimited care from your doctor with total worldwide coverage for major medical, surgery, emergency, everything for these kind of premiums. Insurance doesn't even come close. And
Mhm.
so the key to it is really understanding the pre-existing qualifications and where you might fit when it comes to, is this plan a fit for you or not?
You know, one thing
Um,
we've seen, Troy, is not only is the appeal of these plans obviously the price point. I mean, show me where you can go get a major medical plan that's $1,000, deductible, if you will, and then having a $3,000 out of pocket. You're going to pay way more than this. I mean, we know because we sell them all the time to groups. So and then if you're in the individual marketplace, even more so. So we know the price point is really good, and of course capping that at 3 times per the event. So we know this is very competitive, anywhere from 35 and in some cases 50% of the marketplace is what we've seen. But the other thing we really love about this is how it so dramatically affects the out-of-pocket exposure when something actually happens.
Yeah, this is a great little scenario because people want to, they hear it, they see it, they feel like it's too good to be true. It's not because it has pre-existing condition qualification. But when you really play out the scenario, this is a beautiful picture. So let's say we've got a PPO insurance plan, maybe it's a Blue Cross and Aetna or whatever. And then over here, we've got our plan through America's Benefits. If we take a 52-year-old male and he's got chest pain, calls an ambulance, goes to a hospital, gets diagnosed with a blockage, ends up having heart surgery, goes ICU, rehab, and goes home, When we play this out with insurance, we're going to be susceptible to the high cost of the premium first, which is expensive depending on what plan you buy. Second, you're going to have to pay copay, all your deductibles that apply. You'll be susceptible to co-insurance, probably 20 or 30% of the bill, and then you're going to hit what's called maximum out of pocket. And this is assuming you stayed in network. So with insurance companies, you have to stay in network. So you're out of pocket, much higher cost. You've got a huge max out of pocket cost plus the cost of the premium. So if we come over to our plan, we look at what you pay for the plan with your doctor and coordinated care. Then we look at the whole same procedures, same hospital, same everything. The member would only pay one IUA. They'd pay $1,000. The rest is paid 100%. And so it really doesn't compare. I mean, it's kind of like a watermelon to a grape comparison. So these plans are much higher functioning, they're much higher quality, they have much better coverage, they're worldwide, you don't need network, but you have to manage the pre-existing condition if that applies. This is another scenario with a lady, 35-year-old female, she's got cancer and she's got a serious situation going on with oncology, MRI, surgery, recovery, and ongoing treatment. Same thing. If she had Cigna, she'd be paying high cost for premium. She'd have a big deductible, copays when they apply, and then you'd hit max out of pocket. And so at the end of a year, you're going to be out the cost of the high premium plus the maximum out of pocket. So not real high functioning, not a lot of coverage. It's catastrophic, but it's high cost. And it has to accept all risk under the ACA, which is why it's insurance, it's regulated. Over here on our program with the doctor, the components, and the cost sharing, a member would only pay the 1,000 IUA once because anything related to that event after that is covered unlimited with no cap. So once again, you'd only be out of pocket 1,000 plus you'd be saving on the lower cost of the premium. So again, the comparison shows you what high functioning, high quality care is all about. Um, this one is another one where it's a 15-year-old female. This is more of a trauma. Got a knee injury, sees specialist, MRI, ACL with surgery, and goes through physical therapy. Again, the only thing they'd have to pay on our plan is the one-time event on the diagnosis for the IUA. That's assuming they went outside primary care. So I'm assuming there's a specialist here. So they would pay the 1,000, and then after that, it's all paid through cost share on your behalf. On insurance, you'd be susceptible again to copays, network, co-insurance, max out of pocket, and the higher cost of the premium, say with Aetna. So it just allows people to understand health care coordinated versus insurance that's very disparate, uncoordinated, and has too high of cost. Um, so the last part of this that really makes the program beautiful is we've taken the plan designs, we've taken the providers, and we've integrated them all. And we've put them on one piece of technology where once you see the plans, you can log in and enroll, set up your demographics, your information. You can choose the plan through a 4-step process. You can set up your payment, and you get a portal for life. So in that portal, you would have your ID cards, you'd have your benefit summaries, you'd have 24/7 customer service 800 number, you'd have call routing for customer service, and you also have a help desk. So at any time you can ask. Everything in your health plan is in one single sign-on spot. It's all coordinated, and it's all available to you anywhere in the world as long as you can log in with internet. So it's really a integrated, comprehensive program that's really at the touch of your fingertips. Customer service we take very serious. So we've programmed in direct numbers to our providers. So if it's virtual care and you're working with your MD, you can call a number direct anytime. You'll also have a mobile app for your doctor that you can communicate with them 24/7. If it's cost sharing and you've got an issue, say you're in Germany or somewhere and you need help with assistance on your IUA and taking care of payment, you can call Zion Direct with your ID card, or the provider can contact Direct. The pharmacy benefit, you have an ID card that you can present at time of purchase and you'll just pay your copay, and then you get your pharmacy. Counseling and mental health has both text, email, and direct phone number. If something's up, if you had suicide or PTSD or anxiety or whatever the case might be, marital counseling, you can get them for your 8 visits. Lab, of course, is through Quest Diagnostics. And then the minimum essential coverage plan would be for that ACA mandate coverage. So customer service is important, and it's all built into every aspect of the plan.
So at this time, we always run into a lot of questions that people have. And the last time we did this, it was kind of interesting because Troy and I were talking afterwards, and the presentation lasted about 40, 45 minutes, kind of on track. We're just a little bit quicker this time around. But the questions afterwards were literally like 40, another 40 plus minutes of questions from realtors and other self-employed professionals. So at this time, I'm going to go ahead and just unmute everyone so we can hear you. And if you'd like to just ask us questions while we have Troy on the line, you can certainly do that. And between he and I, we'll do our best to provide you with the answers that help you have a clearer understanding of how this specifically relates to you and your family and might be the right fit. So do you have any questions?
Don't be shy.
I think I unmuted everybody, but let me make sure. Oh, I'm trying to make it so everybody's unmuted. Hang on one just a second here. We had a little snafu in the technology. So if you're trying to talk, I can't hear you yet. But let's see what we got. Unmute all attendees. Yes, please. All right. So can someone just say something so I know you're unmuted if you're on the other side of the line there?
I had to manually unmute.
Okay. Yeah, actually, I'm seeing that. So I think for each of you, you might have been muted initially. I've like released the lock of that. It's almost like a little lock on your windows in your car. The children's lock has been lifted. I'm teasing. But go ahead, and if you have a question, if you would just unmute, that would be great. Ask the question, and then if you can remain muted just to reduce any background noise, we'd appreciate it. So what questions do you have? All right, well, while you guys are thinking about them, if you are, I think we've covered most of these. And again, there are some hot links, and we'll provide this presentation as a follow-up to each of you that have registered. But we've covered, obviously the difference between the direct primary care and the virtual primary care. Troy, I believe you referenced if they needed to see a specialist, how that would really move into the medical cost sharing component. If you have a pre-existing condition, we've talked through what that is with the 24-month look back, as well as the exceptions to that with some of those conditions. Was there a question?
Oh,
All right.
just some background noise.
Yeah, just some background noise. That's okay. One thing that's that fourth bullet point down there, will rates increase each year? Troy, you want to take that one? Because I love the answer to this.
Yeah, this is very common to all insurance. So really, when you look at rates each year, it's based on claims versus premium. So when you look at an insurance pool, if it has to take all the risk and it gets a lot of sickness, rates go up, which is why we see in traditional insurance, the rates keep climbing and coverage keeps getting carved out. In this plan, because primary care is at the heart, unlimited managing disease, and because the pre-X risk management component is in the cost share, it really avoids adverse selection. So the pool has been very healthy. It's doing very well. And over the past couple of years, there have been rate decreases. So I always show people, when you look at risk management and a healthy pool and good engagement with primary care, we're seeing better performance, better outcomes, and better cost control. But on the insurance side, we're seeing a little more risk, a lot less healthy, and costs are spiraling. They're going up, especially with COVID. So in our case, the rates have been actually going down, and we're managing the risk pool much better because of risk management.
Take that next one if you would too, Troy, about either an MRI, CAT scan, or really any kind of advanced radiology or diagnostic.
Yeah, so usually depending on the capability of the primary care facility, whether it's virtual or it's the direct primary care, some of these have in-house X-ray and lab, some don't. So depending on which provider you choose or which provider is assigned, you may have to go outside, which would be Quest Diagnostics. So if you go to Quest Diagnostics, you're going to get up to 75% off running a referred test or scan through them. Now, if you're admitted to, say, a surgery center or a hospital upon emergency, it may apply now to your IUA. So it's probably a major event or you're going in for a surgery, you name it. So now you would fall not to primary care, but now you would fall on your ID card, which is your IUA. So as long as you haven't paid for that event once, you'd have the IUA. But if you've met the event once or you've paid an IUA, it may be covered 100%. So it just depends on the scenario. The other one that I wanted to mention that I didn't mention earlier is there's an incentive to the IUA. This is really important. So to really help people stay working with their doctor in coordinating surgery specifically, if you work with our cost share provider and their medical management team, coordinate with your doctor, and you pick any surgeon you want, we will give up to 50% off the IUA for coordinated surgery. So hopefully that makes sense to people. So if you know you have a surgery coming up, or your doctor says you need a rotator cuff or whatever it might be, we give as an incentive up to 50% off the IUA if you coordinate that benefit, because it allows us to pre-negotiate, pre-authorize with the provider, the surgeon, to get it at best cash discount, which is an incentive to us to manage the pool. So we give you the incentive of only having to pay half the IUA, which is, insurance doesn't even consider that.
No, they
So
wouldn't do
big,
that.
big
They,
advantage.
I believe their earnings per share might increase. So if you own their stock, you might get a yield out of it. But other than that, it's not really going to do much for you as a member, for sure. We really like that. I'm glad you brought that up, because as we were, putting all this together and working with Troy to integrate all this for us, the fact that the direct primary care physician was really driving the bus, and then, as he mentioned, was able to get us the quality care we wanted. We can still select who we want to work on us, but because that direct primary care person is really directing and advocating on behalf and helping us, in a sense, concierge and navigate the healthcare system to provide, like you said, the cash price or have access to that, the fact that that savings somehow doesn't come out of my pocket when I pay that IUA, it actually reduces my cost even below what it already is, was just a huge advantage. So instead of enriching the plan and shareholders, it's really brought back to the member themselves in savings if they take advantage of that incentive. So we really like that. I'm glad you brought that up. Moving on here, what is initial insurable amount? We talked through
I have
that.
a question.
Yes.
You got it.
Is there a way to look at these primary care doctors and locations prior to signing up?
Yes.
Yes.
Go ahead, Troy.
Yeah, I guess I think upon this webinar, you'll be sent a directory. So you can look and see where all the contracted primary care physicians are in regards to location demographic. And if there
Okay.
isn't one in your area, a lot of members will choose the silver plans or the what's called the enhanced plan, which is virtual, until we can campaign a doctor in your area. So some of it, we're developing like anybody. We're constantly contracting new doctors. But virtual, we have coverage in all 50 states by providers. It's the brick and mortar hands-on doctors that we're growing rapidly. But if you had a doctor that would want to go subscription, we can contract them too. So it might be a doctor you already have that you'd say, I want to keep my doctor. So we just have to get in touch with them. Does that make sense?
Yes. And what about hospitals? So if some catastrophic, like you said, a heart attack or something, you can go to any hospital?
Yes, you can go to any facility worldwide, because now you're not in primary care. Now you're on cost sharing. So cost sharing is beautiful because it doesn't tell you to stay in a network. You only have to pay your IUA. After that, you just present them your ID card. They'll contact Zion or us for the billing, and then we pay cash direct on the spot. And if they don't accept cash direct on the spot for best price, they can bill it to us at PHCS Multiplan under PPO contract, and we'll pay that as well because we have the PHCS contract.
And if you want to, Troy, just reference the on the spot, because for, anytime you're in front of a provider and you need care, their question is always first thing, they're conditioned and programmed to just verify benefits because of insurance, right? So let's verify your benefit. What's your deductible? What's your expense? And then ultimately, what is the insurance and how am I going to get paid? All the provider cares about is how am I going to get paid, right? And so
Right.
what we've found with this worldwide piece of it, whether they go through PCHS as kind of a default direct network, or if they accept the cash price, is that they're getting paid so fast. So Troy, you want to reference like how fast that payment happens? You say on the spot. I mean, what does that mean?
Yeah, so over the past couple of years, growing rapidly, we were paying within 5 business days. And what's happened now is because the amount of money in the pool, the ability to pay, we've got banking credit lines now where we can pay on the spot in less than 24 hours. So if you're in Germany or you're in Israel or you're in the Yukon of Alaska or you're somewhere just way out there and you present your ID card, we can pay them right on the phone. And so they're like, oh my gosh, he's in for surgery and he's got a trauma or whatever the issue might be. The member just pays their IUA or works that out with the doctor. then we pay the rest 100% with no cap. So it's very quick to the provider.
My last question was on pre-existing conditions. For instance, my wife had breast cancer like 27 years ago. Is there after a certain number of years, is it still considered pre-existing?
No, so she had a condition, she was treated, she's been cancer free, and in the past 24 months, has she had any diagnosis, treatment, or been hospitalized for that? If she hasn't, she doesn't have pre-ex. She's fine.
Okay, thank you.
Yeah, so that's a great question because that comes up a lot where people say, I had cancer 5 years ago, I went through full treatment, but I've been cancer free for 24 months. Then no, you wouldn't have pre-ex coming on the plan.
One thing to note too, we just had someone sign up recently that's not a realtor or other self-employed professional. Actually, it's an old client of mine that was the president of a large construction company, sold his company for just a lot of money and is living the good life. But he, he's got a couple years before he gets to Medicare, and he was very concerned about having quality care. So he went out and looked for individual plans, and he was insured with Blue Cross Blue Shield actually, and was paying a tremendous amount of money for it. He had me look at the individual market for him, and I found another plan like United Healthcare. And again, we're not here to say bad things about those insurance companies. We're just saying this is different. And so he was looking at that plan, and I bring it up because of your question about your doctor. Like, hey, how do I see who the doctor is? Well, if you already have a primary care doctor that you really like, to Troy's point, we can always approach that doctor to see if they'll come into the network. So in this case, with this gentleman, we did. We had Dominica, who's part of the America's Benefits Consortium outreach plan with our integrated partner Align, and they reach out to the doctor and they provide them this kit that shows the membership piece that they get paid every single month just because you picked them as the doctor, right? So they get paid whether they see you or not. It's just part of the way the compensation works for them, because you're in the DPC, they're in the DPC directory, the network. So, they make the outreach, but this doctor's billing people didn't really respond to that outreach. And sometimes that'll happen. They're busy doing their thing. They don't know what it is necessarily initially. We've seen that, first off, it's much more strong when you, as the healthcare consumer, actually drive it through your doctor and you say, hey, I'm joining this, or I'm on this, and I want you to get in this directory network for me. So you can help us grow the network by, making that outreach to the doctor. So that's one point. The second point, though, was that prior to that, as Troy was saying, and that's why I have the enhanced plan on here, is you could just have the virtual plan, right? In the meantime, and you could pay your primary care doctor directly a cash price just out of your pocket. And the savings point is so significant. So here's the thing. I had a plan for this gentleman that was a $1,000 deductible. This was with United Healthcare, $1,000 deductible, 20% co-insurance to a $5,000 out of pocket for just him, right? He's over 50s, a couple years away from Medicare. His premium was $1,047 a month because he's 63 years old, right? Great health, no pre-existing, no issues. So he could pay this amount right here, have all the bells and whistles of everything we've talked about, including the medical cost share worldwide, and he still saved a ton of money each month, to where even if he went and saw his doctor 2 or 3 times a month, not that he would, but even if he did, he's still way ahead financially, and he's still seeing his direct primary care doctor if he wants to, and paying a cash price until that doctor responds and possibly goes into the direct primary care, which then would bring him into a premier plan. And this gentleman who just signed up, he could then switch, because again, you can switch any given month. He can switch from the enhanced plan to the premier plan, and now he doesn't pay the doctor a cash price anymore. He just pays his new monthly amount, and that doctor is now in the network getting paid for the membership that he has with him through the direct primary care. So it's a real, even if you had to do it that way to still have access to your direct primary care doctor, the price point that, Troy and I always say, do the math. The math works out so well that it still provides a very strong solution for people financially without compromising any of the quality care or the comfort they have in those physician relationships.
Yeah, you'll notice in these programs, the difference is it's really one-to-one quality care, and it's coordinated care, where we've really put the incentives back in alignment, and we're really driving primary care engagement If you need pharmacy and lab, you got it. But then if you go to major medical surgery, whatever, then it becomes cost share instead of insurance. And cost share and insurance really are similar. They're just pools of money that are paying out claims, bringing in premium. But the key is how you manage the risk. And I think in this model, there's much better risk management because of the pre-existing condition phased in benefit. It's having better performance, better user experience.
Mm-hmm. So we answered this question right here. This last one is there a minimum membership term? And there isn't. You can come on and go off anytime you want on a month-to-month basis. You basically, as you enroll, you put in your payment information and you just pay. You have to pay by the 20th of the month prior to the month that you want to sign up for. So if you wanted to sign up, let's say as early as
Well,
September 1st.
you have to enroll, Mark. So you have
That's
to
what,
enroll by the 20th. Sorry, you'd pay on the 1st. So the payment for the plan is always the 1st of each month. But if you want to be effective on the 1st, you have to enroll by the 20th of the previous month.
got it. Thanks for the clarification there. And then
Yeah.
last but not least is, I would tell you that if you have additional information, if you have additional questions, you can certainly reach out to us here at info@americasbenefitsconsortium.com. But one question that's come up actually quite a lot with realtors and other professionals is, in our last two webinars we've done this, we've had people ask us this specific question. They said, do you have any kind of affiliate program? Because like I'm a broker and I know a lot of other, real estate agents, or I'm just an agent and I'm really well networked with all these people, or I'm a cosmetologist and I work in this salon center with, 13 other people that are in the same situation as me. And wow, this really makes sense. So is there some kind of affiliate type program where if I were to introduce other people to that, could I get paid some kind of, referral fee or commission or something? So the short answer is yes, you can. We built this out with a little bit of compensation in there for that very thing, so that if you're interested in that and wanted to find out more, by all means, reach out to us right here, info@America's Benefits Consortium. You'll also see an email from me, Mark, at Dorado Benefit Advisors. It's a follow-up to your participation today, and you certainly can direct that email to me, and we'll answer questions about that piece of it too. Just so you know, it doesn't reduce your premium as you sign up. It would just be an affiliate relationship that would pay you for the people that you basically referred the program to that actually signed up. So there is some compensation there if you have some kind of network of folks that you feel like might benefit from this as well. Any other questions while we have Troy on the line?
I have a question.
Mm-hmm.
So I noticed in some of the examples where it was showing, if there's a major medical expense or need or whatever, that it was regarding the premier. So is that different from the basic or from the middle plan? Is that?
Yes, so that's a great observation and question. So the basic plan would be unlimited primary care with pharmacy, lab, and mental health, but there's no cost sharing. So if someone had a major medical event, surgery, hospital, whatever, on the basic plan, they'd have no coverage. They would only have primary care. So if they go to the enhanced plan, they would have full cost share. They would have everything but virtual only for primary care. And if they go premier, they have virtual, on-site, hands-on primary care with full medical cost sharing, everything. So it's kind of a tiered benefit. So basic's really kind of the loss leader, least expensive. And it's really for healthy people that just want a one-to-one doctor during like a pandemic and they just can't afford anything else. Enhanced is really good because it's nationwide. It really is your primary care physician, but it's virtual. And then you can go to any doc you want for specialty or major medical under the cost share. But Premier is the one where it's hands-on. That's the one where you have a brick and mortar doctor, clinic. You can see him face to face, plus virtual. And then it has all the parts with full medical cost share. Does that make sense?
It does, but I guess I'm just a little bit confused with the full medical cost share, I guess, because when you showed that previous slide, it pretty much looked like it would be identical except for, the unlimited in person. So if I didn't, really want the in person or same day or next day guarantee thing, and it was just like, maybe my daughter broke her arm or something, then that's not going to be the same coverage.
Yeah, because the cost share is specific to cost share. So that's when you go outside or beyond your primary care doctor. So if you, here's an example, because I do the plan myself for my family. I do the Premier. So I have a doctor that's my doctor here in Portland, and he's virtual and he's on site. And anytime I have anything that's not life threatening, I just go to him direct. So for instance, the other day playing at a sports game, a child broke their arm, and it wasn't life threatening, but it was a broken arm. So we took them to the physician, my primary care doctor, and in his clinic, he x-rayed it, he set it, he reevaluated it, he treated it, packaged it, sent us home with some meds, did the whole thing. And the only thing we had to pay for out of pocket was one image of the x-ray, and that was it. So it was like $15. And I tell people, could you imagine doing that if I would have gone to ER? Now, that wasn't life threatening, and he has the ability as an on-site clinic, and he's a very trained physician to manage an emergency. Now, if it would have been life threatening, we would have gone emergency, probably ambulance or whatever. When we go to the hospital, we would have presented our cost share card, our ID. Now it's not primary care at all. I'm not using primary care. I'm using major medical. So when I give them my ID card at the hospital, they're going to make me pay one IUA. So our system will tell them the member owes an IUA for this event. So it'd be $1,000. So you work that out how you pay the member, depending on which IUA you choose. And then we pay the rest. So if the ER says, well, it's $8,000 to set this arm and take care of it, the bill's going to be $8,000. The member has to pay the first $1,000. We pay the other $8,000 cash direct to the provider. You don't have to deal with it. Does that make sense?
So that would be on either enhanced or Premier?
Correct.
That's
but
where
not on basic.
Yeah, I think the question, the answer really for you, this is Mark. I think, when we say basic, I'll just put the slide up there if you can see that. So the basic really is just saying, hey, I've got virtual primary care. And again, that's true virtual primary care. Same physicians, same people. There's a continuity of care because they know you, right? It's not like, I love Troy's analogy. It's not like you just called Uber and they're giving you a ride, to the airport. It's you have your own private driver. They know you like it at 72 degrees. They know you like McClellan single malt, 12-year-old Scotch, or Evian water or whatever, right? They know you. And so that's the virtual, and you get that with the basic. And then you get the lab and the pharmacy and the mental health, which are all great value add propositions to that. But there's no catastrophic, medical cost share component in this piece of it.
In the basic part.
Yeah, in the
right,
basic.
no, I get that. I
Yeah,
wouldn't be considering that one.
Right. So the difference between really the enhanced or the Premier is just you seeing them in person. So it's direct primary care where you're going to their brick and mortar place versus you're handling it virtually. Now, if you're handling it virtually though, and Troy, go ahead and pop in here, please. If you're handling it virtually, and let's say it was a broken arm, what would she do?
Yeah, if it was virtual and it wasn't life threatening, you could contact virtual, which is your doctor. They would triage it, ask you questions, identify what's going on, and then they could route you. So they may have a specialist that's in their program that they're going to route you to. They'll notify the specialist you're coming, and they'll negotiate cash discount, and then you could put that on an IUA. So now you'd go to a specialist, you'd show up under referral, and then now you'd have out-of-pocket IUA, and then you'd be taken care of.
Or if we have some like kick-ass doctor like you have, then it would only be like that $15, for example.
Correct. Yeah, and
I love your
only bring that up.
terminology because
Yeah, I only bring that up because some of these direct primary care doctors are retired surgeons. They have beautiful clinics. They have full x-ray lab in-house with nurse practitioners, and some of these are beautiful clinics. Some are just private guys by themselves that don't have that, and that's when you'd use Quest Diagnostics or might be sent to a specialist, or you may have to go ER.
I think we've heard Troy refer to his doctor as kick ass before too, so you nailed that.
He'd love that.
That's funny.
If you move to Portland, I'll show you who he is. No, he's great. He's been great.
So does that clarify just like, in different scenarios of like, the enhanced versus the Premier for you? Okay, one's direct, one's virtual, but you still would have care. It really is just if you really want them to if you want to be there in person in their building, their clinic, like what Troy has, and there's all sorts of options in Arizona. One thing to mention that I don't think we said, and the map didn't really show this well, because the map, we had to kind of create that the way it looked for the presentation, but kind of a screenshot, if you will. But the map, when you look at that, there's a bunch of people in Tucson too, even though it didn't look like that on the map present, the slide.
There's a lot of
But
doctors in Arizona.
yeah, there really is. Arizona, my point is that Arizona is actually one of the most prolific direct primary care states in the country. I can't really tell you I know why. I just know that they've been very strong and one of the early pioneers of adopting that. And some of the doctors that, Troy, I know you've spoken with, we've spoken with, they really are sick and tired of all this consolidated, Banner, Aetna joint venture, factory medicine. They're over it, Honor Health this and Dignity that and Abrazo, whatever. They're tired of somebody telling them that's a corporate bureaucrat how to care for a patient, what to charge, all these other factors. So they want to get back to practicing medicine and doing it to the benefit of the patient. And you really do see a very, earnest attempt to change the game from the doctors too. And I think that's why it's had such prolific growth in Arizona. So there's a big network access point here in Arizona that I think you'll be able to find.
Mark, I'm gonna have to log off. I have another webinar, but I'll leave this with everybody to file questions or to answer, to ask questions, and I'll be of any assistance I can. But I really appreciate everybody attending the webinar, and we'll look forward to having you as a member so we can help you move on to better health.
Great. Thanks, Troy. Thanks, everyone, for attending. As I mentioned before, if you have questions, you can direct them to info@America's Benefits Consortium. I will be sending out a follow-up email. My name's Mark, and with Dorado Benefit Advisors. We'll send that out, and you can certainly interact with us about the program, about affiliate, and all the other things. We're happy to help. We really appreciate your time and interest today. Thanks for joining us. Goodbye.